back. This is Boomer Life on CL 650.
Welcome back to the program. Sterling Fox with Dr. Fadi Tarazi from False Creek Healthcare Center joining me in studio on the program today. Dr. Tarazi is an orthopedic surgeon who specializes in shoulders and knees. Correct, Dr. Tarazi?
Yes.
Okay, well, that's and I wanted to ask you about, you've mentioned a couple of these. We were talking earlier about these minimally invasive procedures that are now more common than not in orthopedic practices and surgical procedures, where they get the fiber optic scope in there and the camera and so on. We hear a lot of terminology, whether it's not on the sportscasts anymore because all they talk about is lower body injuries, but we hear about the ACL, the PCL, the MCL. All of these are everyday terms in your business. What do they mean?
So the ACL is a very common injury. It's an anterior cruciate ligament. It's the main ligament in the knee joint that provides stability with jumping, twisting, turning, and lateral movements.
Okay.
So typically that's the ligament that people need to run and change directions, such as in soccer, volleyball, or football, basketball, lots of sports. You need that ligament.
Okay.
Skiing, also another very common sport
Absolutely.
that needs an ACL. So with those injuries, the ligament is torn, and now the knee becomes unstable with lateral movement and twisting. And those are the injuries where very often we see the patients that we have to reconstruct the ligament,
Okay.
make a new ligament in the knee to re-stabilize the joint.
Yeah, because you hear of a football player, for example, with a torn ACL.
Yes.
So that tear can be repaired then.
We replace it with a new ligament.
Okay.
We don't reattach the ligament. They used to do that in the past, but it doesn't work well. Now we replace it. That's why we call it a reconstruction.
Okay.
And we replace it with other tendons from the body.
Oh, okay.
And so that the ACL is a very common injury. PCL is much less common. It's called the posterior cruciate ligament. It occurs when people get hit from the front of the leg, especially in a tackle from the front in football or rugby.
Right.
And that requires less commonly surgery. More commonly we use a brace, but if it's very unstable, then we can reconstruct that ligament as well.
We hear something, again, it happens in sports a lot, a hyperextended knee. Is that one of those CL?
Yes, you can injure the anterior cruciate ligament or the posterior cruciate ligament in a hyperextension injury, depending on whether there's also a rotation component to it.
Okay.
So that does occur. The medial collateral ligament and the lateral collateral ligament injuries are ligaments that provide stability. Those ligaments provide stability with side-to-side movements, so they usually tear or sprain when the individual gets hit from the side.
Okay.
So typically an opponent falling on the side of their leg in a sport,
Right.
or getting tackled from the side, typically in a football or a rugby injury.
Okay, but a lot of the patients you see with these ACL and MCL type injuries are not professional athletes. These are beer league guys who get bashed up at 11:30 on a Friday night playing with the boys out at the arena, right?
Yeah, it happens everywhere, and with any sports, it can happen in any age. And we see professional or non-professional, recreational, or the Friday night guys.
Yeah, exactly. Now, the other joint in the body that resembles the knee is the elbow.
Yes.
So do we have such, and we talked about knee replacements extensively. Is there such a thing as an elbow replacement?
Yep, it does exist. It's much less common elbow arthritis, but it does exist.
Okay, and shoulders we've already talked about.
Yes.
So now that we're on the shoulder and the elbow, I wanted to get you to tell us what Tommy John surgery is. But before I do, I should let our listeners know that at False Creek Healthcare Center, they can perform Tommy John surgery. It's a baseball injury unique to a very few individuals. But when it comes time for a Tommy John surgical procedure, by gosh, the Toronto Blue Jays doctor jumps on a plane and comes out to False Creek Healthcare Center and performs the surgery himself, doesn't he?
Yeah, he does. That's Dr. Sheps, and he's the doctor for the Blue Jays, and he comes occasionally here whenever there's a patient that needs it done.
So what exactly is Tommy John surgery?
So the injury is the tear of we call it the ulnar collateral ligament. It's a ligament on the inside of the elbow.
Okay.
So with baseball pitchers, and only pitchers get it, as they throw the ball, they can apply enough stress on the inside of the elbow to tear that ligament.
Because they're flicking their wrist at the last
Yes,
second.
there's a rotation with sometimes knuckleballs or curveballs, and they have enough rotational component along with the stress on the elbow to rip that ligament. If it's just strained, then it heals on its own. But if it's stripped, then it has to be reconstructed. And the Tommy John's procedure is basically a reconstruction of that ligament.
Tommy John, of course, was a New York Yankees pitcher back in the 1960s and 70s, for whom the procedure, I guess he was probably the first guy that had it done.
Yeah,
And now, and you were talking about this earlier, and now you hear about, and again, especially at the high school level, you hear about young boys getting Tommy John surgery. That's hard to believe.
Yeah, because there's a demand on trying to learn as many different types of pitches as possible in order to succeed in that sport and be picked on the team.
Well, now move down the arm a little and let's talk wrist. And the rotation on the wrist. And this does not happen to baseball players at all, uniquely. You can go to a grocery store, and in many cases, you'll see the young woman who's checking you out at the stand is wearing some kind of brace on her wrist. And I've asked a couple of them, well, did you hurt yourself skiing? And no, I have carpal tunnel syndrome, and I have to wear this on the job. What is carpal tunnel syndrome?
The carpal tunnel in the wrist is basically a space that tendons and one of the nerves called the median nerve pass through, and it goes from the forearm down to the hand. The median nerve gives you sensation to the fingers.
Okay.
So if there is repetitive stress on the wrist, especially with typing, so typists very often get it, or people that work on computers a lot, and there's stress on that carpal tunnel to the point where the nerve is being compressed.
Okay.
Braces can help alleviate the symptoms, but if the braces are not enough, then you have to open up the carpal tunnel to release the pressure from the nerve.
And now, is this the sort of procedure that you, an orthopedic surgeon, would perform?
Generally, carpal tunnel syndrome surgery is done by an orthopedic surgeon specialized in hand or by plastic surgeons. So there's an overlap between those two specialties.
Okay. Now, you said your specialties are shoulders and knees. And those would be, perhaps in terms of the general population, the most prevalent areas of orthopedic surgical procedures, right?
Yes.
To the most popular.
Very, very common.
Okay, and what are the most common ailments regarding shoulders? You talked about rotator cuff problems earlier. Is that it?
Yes, very common. As we get into the 40s, 50s, and 60-year-olds, that becomes very common. As the tendon gradually wears out and eventually rips, you can also have tendinitis in the shoulder, and all these conditions result in pain and disability. And that's why patients present for treatment for those conditions.
Okay, and I'm just going through. I'm imagining all the areas of the body where an orthopedic surgeon, and you have a team of 14 orthopedic surgeons down at False Creek Healthcare Center. You're not alone in this game at all, are you?
We have a surgeon for everything.
Exactly,
very much.
Exactly, and I suppose the best part about it all, including the talent that you have all under one building, is also the fact that you have all of the equipment required, state-of-the-art, the latest of everything, again, right at your fingertips or right down the hall, easily and readily available at all times.
At all times.
And that is enormous because, of course, that's, in some cases, speed is of the essence, isn't it?
You don't want to delay treatment. So if you need a test to plan a surgery for next week, if you need something quickly in the meantime, it's available.
You also said
you don't have to delay anything.
As you were beginning the program with me earlier, you also talked about trauma. You said that some of the work, some of the time you do as an orthopedic surgeon is spent dealing with trauma. What does that mean?
Trauma is basically an injury to the skeleton. It could be a blunt force trauma, such as, let's say, in a car accident. It could be from a fall from a height, fall from a roof, a work injury, and as simple as somebody walking on the stairs and tripping and falling, breaking their wrist.
Right.
So all these are in the under the umbrella of trauma, what we call trauma.
And we also talked about some of the time that you spend dealing with workplace-related injuries. That would fall under the general category of trauma, then, wouldn't it?
Absolutely, yes.
Somebody gets bashed up at work, and in many cases, again, there is a situation in which speed may be critical.
Yes, sometimes you have
to get that broken bone attended to right away.
Yeah, sometimes in a trauma also they can have an acute tendon injury. It happens in the elbow, let's say, where they tear the biceps tendon. You can have an Achilles tear at work as well.
Right.
And those injuries, we have to fix them quickly in order to have a better outcome. You cannot wait months and months to fix them. They have to be done quickly. So that's one of the advantages, is that we have the ability to investigate patients quickly and fix the injuries.
And in our remaining very few seconds, a final note to boomers listening to us right now, dealing in silence with arthritis. Any thoughts about go see a doctor? Help us out here.
Initially, when the first pain starts, the most important is to first keep the joint mobile. It is very common that we see people with frozen shoulders or stiff knees. Joints don't like stiffness, they need to move. So get the movement back. If the pain persists, then consult with your family physician to get a referral to an orthopedic surgeon.
Dr. Fadi Tarazi from False Creek Healthcare Center, a real pleasure to meet you, sir. Thanks for coming down and just spending some time with us on Boomer Life.
Thank you for having me.
And we'll see you next time, right here on CL 650.